COVID-19 was something that I already faced. The fact that I had to wear a mask to protect myself, to keep distance. And during the lockdown especially, I felt even safer because I knew that all these precautions were fine and useful to keep people safe.
In March 2020, I caught COVID. Very unfortunate to get it so early on, just as lockdown happened. Within about 5 days, I really started to become very unwell. I had the awful choking cough. I was absolutely petrified that this would mean death, certain death for me. So it was an incredibly frightening experience and one I would hate to repeat.
What concerns me more about COVID-19, of course, is the fact that we haven't found a cure yet. There's always some surprise around the corner. So this what worries me. Also, another concern is about vaccines, because still I don't know if my body can, handle all these vaccines, all these boosters, for how long. So this is a main concern.
Nearly 2 years on, in fact more than 2 years on, I'm still not back to my old self. So COVID still concerns me. It concerns me because I don't know exactly how it has left me. I know that I have continued to have issues with my breathing, issues with my heart rate. I've had brain fog and fatigue like nothing I've ever had before. I think, like many of us, we feel that we have been left to the side. We're not really getting the support that I feel we need.
I think we should be even more strict with laws and rules and severe, like, for example, closing national borders and not letting people go around the way they want, like, for example, block all the international flights. I know it's about economic, it's about jobs and people, salaries, but health is more important.
And I think for anyone with an underlying health condition, it's really worrying that people almost have become dismissive of people like me, and dismissive to the point that, oh, you have an underlying health condition, so therefore it's going to hit you harder. And it's almost accepted that someone who has another medical condition can be left up to their own devices, or perhaps even die, and they're not seen as accounting for as much as a healthy individual. So I'd like to think that messaging would be much clearer, that we all count, whether we have an underlying health condition or not, whether it's a mild COVID or a severe COVID. So any future pandemic, I think we all need to understand that everyone is in part of a learning process, and that learning process can impact us all in so many different ways.
I exercised more. I took more vitamins, so I read more about all the ways to use natural medicine to have a better immune system. And so this is something that I feel is important to do, and COVID-19 made me do it. And I'm happy I've done it, because I think that my immune system now is better because I care more, even more than usual.
I understand that we all have had to shift in terms of how things are done with COVID, and therefore my care is done differently. Even my asthma review is not done in person, but is done over the phone. And again, that's something which I suppose we all have to get used to. In terms of hospital care, that also has changed, and going to a hospital, you can't bring someone with you as I would have done previously. And that, I suppose, is challenging for many people. It's always good to have someone listening to what is being said to you, but that no longer is the case. So I think care is forever changed as a result of this pandemic, and no doubt will continue to change as we move forward.